Hey, my name is Dr. Sean Price. I'm Clinical Director here at Chiro Spa in Fort Walton Beach. This is video number 2 in our low back pain series, more specifically our stenosis series. Last week we talked about a little bit about what stenosis is and how that's an actual narrowing of the foramen, or the hole that the nerves are supposed to come out of, or that the spinal cord goes into. Today we want to talk about some causes of that. It's a misunderstanding that it's only a structural issue, and the fact of the matter is that, at least clinically in our office, we see that about 60% of the cause or the effect of stenosis comes from structural or neurologically based issues, and about 40% comes from metabolically based issues. So there is a combination there, and that's what makes the treatment that we offer in our office unique, in that we address not only the structural, your bulging disc, herniated discs, arthritic spurs, things along those lines, but we also address the neurological and the metabolic. So what are some of the causes of stenosis? Well, we've got things like weak cerebellar output. The cerebellum is the part of the brain that controls what we call accuracy, balance, and coordination, and it also controls and coordinates the function of the paraspinal muscles. So if you have weak cerebellar output, then those muscles in the spine are going to be out of balance, and they're going to cause the joints to not function in a balanced manner, which can lead to wear and tear and can lead to a stenotic situation. Low oxygen. The brain thrives on oxygen. As we age, our body's ability to utilize oxygen decreases, and when you have decreased oxygen supply to the brain, into the neurological tissue, then you can end up with neurological deficit, which can lead to the stenotic situation. Insulin resistance is a metabolic situation, leads to chronic inflammation, which can lead to stenosis. Sprains and strains, obviously physical traumas, can lead to situations where the ligaments may become lax, or the muscles may become damaged, and cause malposition of the vertebrae and cause that stenotic situation. Disc herniations, this is obviously a physical cause. A lot of these factors that we just talked about lead to disc herniations, and if these factors are not resolved, then the body will continue to function abnormally, and those discs will continue to degenerate and continue to lead to herniate even further. And then last but not least is spondylolisthesis. That's actually a ligament laxity or damage to the joint, to where the vertebrae actually slide forward or backwards on each other and can cause that stenosis. But the key factor here is you can't just focus on the structural issue. You can't just focus on the disc and why it's bulged. You have to figure out, okay, why did the disc bulge? Why did the disc herniate? Why is arthritis forming? Is it because of chronic inflammation? Is it because of nutrient deficiency? Is it because of insulin resistance? Is it because of all these other factors, both neurological and metabolic, that could be causing these joints and these discs to become weak in the first place? So I hope this makes sense. If you have any questions, please post below, and I'll see you next time.